again, a related health services industry, where we have been talking about the healthcare insurance probably. This is the most, this is the one thing which has been, I think, for the last 20 years, keep growing up. And we cannot live without healthcare insurance. So, Millie, of everything you have put into production in your career in terms of AI, what genuinely reinvented a process rather than just speeding it up, rather than just maybe increasing the efficiency? Is there anything AI you have implemented which has completely transformed the process or the outcome for the recipient?
Yeah, so I just want to call out a couple of observations which kind of surprised me also. So, in the healthcare industry, if you talk about benefit plans, if you talk about the compliance rules, they change. They change pretty constantly. And and of course, if you have to do it manually, it requires comparing the new requirements with your existing technology capabilities and the operational teams, which would mean an army of people doing that data reconciliation. And with AI, of course, it amazes me in terms of how AI can read, can compare efficiently, can also predict. And today, that's a big achiever from AI. In fact, I would call it a makeover, where there are cases where we are able to save such a lot in terms of not only using AI as a perspective of leading to a phase where it actually helps in the entire strategic product management. To name some of the examples and experiences, for example, in healthcare, it is right now used for precision medicine based on the data. Again, the data first is the analogy we always follow, because if the data is right, you are able to identify for a patient the different aspects of it. Connecting to what Dharmendra was mentioning about the genomes, about the entire history of the patient, and to be able to analyze that entire population data and suggesting the right kind of therapeutic procedure for the patient, which kind again is a makeover, keeping in mind that our patients and we struggle in terms of getting the right treatment at the right time. But with AI, this is a perfect example where we could see wonders. The second example which I want to bring in is in terms of the clinical insights, whether you call it, using the computer vision or AI in terms of analyzing the X-rays and the kind of detection it is doing in terms of identifying the nodules in lungs, which is pretty much not that much accurate in terms of what AI does and the kind of makeover it is bringing in to the entire aspect of reducing the time in getting the correct diagnosis. The third point which I want to bring in is again from an administrative perspective, is how AI is transforming the healthcare in terms of optimizing costs in hospitals, in terms of ensuring that we are able to provide the best possible utilization of the beds, whether it is helping the patients in getting the right appointments at the right time with the right physician. And at the same time, also want to pick another example of ambient clinical documentation, where when the patient and the doctor are talking, that gets recorded through AI, and you are able to get quite structured notes. And those are some of the amazing examples which caught my eye and wanted to mention in this forum. Thank you, Gautam.
Miss Mary, very interesting insights. I think it's fascinating to see what AI can do inside the healthcare domain. You mentioned few aspects, administrative aspect, the clinical aspect as well. So again, excellent use cases, I think, and we'll talk about the other things in the next sections.